So it is an absolute privilege to introduce Susan Noonan, who is a physician and a person with lived experience with breast cancer and depression, to share her story. Thank you, Susan.
Thank you. Good afternoon, and thank you. My name's Susan. I'm both a recipient and provider of healthcare services, and I've been fortunate to have health insurance and access to the best health care. That has meant my life. I've dealt with major depression on the bipolar spectrum on and off since I was a teenager. Because of family pressure and the power of stigma, or discrimination, as Kay Jamison suggested, my illness went untreated until the age of 45, when it became severe, disabling, refractory, and I couldn't function. Certainly couldn't work, sleep, or communicate. That required a course of ECT, more than 40 hospitalizations, over 50 medication trials, and 10 years in a clinical trial with a vagus nerve stimulator implant. For those of you who don't know, that's like a pacemaker for the mood center of your brain. What made a difference was the tireless team in psychiatry at MGH, my safety net. They've prevented my rattled brain from taking over and have kept me alive, literally. Then in 2011, along came breast cancer and yet another outstanding MGH team who clearly understood my mental health issues, carefully coordinated with psychiatry to customize my chemo and arrange for the seamless removal of the VNS implant because it would have melted during my radiation treatments. And that would have cost me $27,000 out of pocket that I didn't have because I wasn't working. We all feared I would have had a major meltdown, but my combined treatment teams, my pit crew, provided extraordinary support. I can say, and I think many other people might agree with me, that breast cancer is easier to deal with than a mood disorder because there's greater hope coming from the more standardized treatment protocols. It's generally chronic, not a lifelong, not breast cancer. The mood disorder is chronic and a lifelong relapsing and remitting illness, whereas breast cancer is more often treatable and has a pretty good success rate, particularly in the early stages. There's no stigma, and there's much greater support coming from friends and family. But then, I didn't bother to tell them about my squamous cell skin cancer this year. So, what would it take to have great care be the standard of care? Well, integration of mental health and physical health. That would include a cultural shift in our institutions, where teams of providers with different skill sets work together in open and clear communication with the patient and each other on all aspects of his or her well-being, not just illness-based. Thank you very much.
Thank you so much, Susan.
Thank you, Joe.